Avoidant personality disorder. The best treatment options. Avoidant personality disorder is a lifelong pattern of extreme social anxiety and shyness. Sufferers experience persistent feelings of inadequacy, lack of self-confidence, inferiority and lack of self-worth, and have a tense and anxious demeanor. They tend to be incredibly sensitive, particularly to rejection, and consider themselves to be incapable of relating to others and being socially successful. This can be very distressing for sufferers, especially as they fear embarrassing themselves, blushing, or being criticized if they attempt to bond with others. As a result, people with AVPD will attempt to remove themselves from everyday social situations and will seek out jobs that involve little contact with others. People who are diagnosed with avoidant personality disorder tend to be depressed, and many show signs of other personality disorders, such as borderline, paranoid, schizotypal and schizoid personality disorder. Although AVPD is similar to social phobia, it's ultimately more about fear of social relationships and intimacy than of social situations. Perhaps you've encountered individuals who seem to really struggle in social situations. They lack confidence in themselves, feel inadequate in social situations, and rarely risk getting close to anyone unless they're certain of being liked. They avoid social situations and any type of interaction that they believe will be uncomfortable or risky. People like that may be suffering from a psychiatric condition appropriately named avoidant personality disorder. Personality disorders are complex and challenging in that they are deeply ingrained, lifelong conditions that start to develop early in life. This type of disorder deeply impacts the way a person thinks about, perceives, and relates to himself and the world around him. These disorders are difficult to treat effectively because of their pervasive and inflexible nature, and the fact that those suffering from them are resistant to change. Avoidant personality disorder, as with all personality disorders, leads to a lifelong pattern of unhealthy behaviors. This pattern, along with a very negative self-perception, causes problems not only for those who have the disorder, but also for those around them. In fact, when personality disordered individuals end up in treatment, it's often because someone else, such as an exasperated or frustrated significant other, family member, or employer, who suggested or insisted that they get help. Sadly, though, treatment is often a futile endeavor. That's not to say there are never exceptions, but they tend to be few and far between. As you can imagine, constantly avoiding situations that may feel uncomfortable or risky can create significant problems in just about every area of a person's life: work, school, relationships, and family life. Careers never get off the ground, while jobs are lost because the person can't face her boss, attend important meetings, or handle uncomfortable situations with coworkers. Dating relationships are negatively impacted or ruined by the constant need for reassurance, and marriages are strained when the avoidant spouse never wants to engage in social activities or neglects important responsibilities that require interacting with others. The avoidant patterns can even negatively impact a person's health, if he or she fails to get necessary checkups and medical care as part of the avoidant pattern. The clinical picture. The avoidant pattern of behavior for those with avoidant PD is rooted in intense feelings of inferiority or inadequacy, as well as their hypersensitivity to anything that vaguely resembles, even if it's just imagined on their part, a negativity response from more scrutiny by others. These individuals are usually the classic wallflower, the person who's painfully shy, very quiet around others, and always holds back in any type of social situation or encounter. The avoidant behavior serves as a means of protection, isolating themselves from others, refusing to risk making new friends or shying away getting involved in any type of intimate relationship, and going to great lengths to avoid any social situation that could be awkward or uncomfortable. Each of these things reduces their risk of being judged, getting hurt, or feeling uncomfortable. Those behaviors also protect them from facing the depth of their feelings of inadequacy and lack of social skills. People with avoidant PD are also very reluctant to take personal risks or be adventurous and try new things. They'd much prefer to stay in their very small comfort zone, where it's safe and predictable. Individuals suffering from this particular personality disorders have a very negative self-perception. They see themselves as undesirable and socially awkward. They feel inadequate and ill-equipped to handle normal social interactions. The payoff is that they don't have to face disapproval, criticism, humiliation, embarrassment, shame, rejection, ridicule, judgment. That payoff reinforces the avoidant behavior again and again and again. And it continues throughout their entire life. Individuals with this disorder aren't necessarily complete loners. But in order for them to feel safe or comfortable with someone, they need frequent reassurance. In fact, they typically won't even venture into a relationship with first knowing for sure that the other person genuinely likes them and will truly accept them. Needless to say, this is often off-putting to others, and can kill a potential relationship, friendship or romantic, before it ever gets off the ground. Cause: no one knows exactly why someone develops a personality disorder. There may be genetic and biological factors that make some individuals more vulnerable than others. But many experts believe that the person's early environment plays a significant role. The personality deficits develop largely due to the failure to learn appropriate coping skills while growing up. Avoidant individuals fail to learn how to navigate social challenges in a way that benefits them as well as those they are interacting with. As a result, they continually rely on unhealthy coping mechanisms learned early in life. Treatment: as mentioned earlier, personality disorders, by their very nature, are very hard to treat. If progress is made in treatment, it is usually minuscule at best. Avoidant individuals very rarely seek treatment because therapy is 1, essentially a social interaction, and 2, as requires a fair degree of vulnerability in order to be effective. When it comes to treating avoidant PD, psychotherapy is the best approach. One of the key aspects of psychotherapy, that is particularly beneficial for someone with avoidant PD, is establishing trust and developing a solid therapeutic relationship, that is the relationship between the therapist and the client. If this initial objective can be achieved, then the therapy process will be greatly enhanced. Without these two things, however, therapy with an avoidant individual is doomed. Remember, the avoidant person is to feel emotionally safe and comfortable in order to let anyone get close. With avoidant PD, one of the goals of therapy is to help individuals gain insight into what drives their maladaptive behavior, and how it negatively impacts them as well as other people in their lives. Therapy can then begin to help them learn more effective social skills and behaviors, ones that will allow them to get their needs met in a healthier, more appropriate manner. Medication is not usually part of the treatment for individuals with avoidant PD, unless it is prescribed to treat symptoms of anxiety, depression, or another co-occurring disorder. Otherwise, its effectiveness, if any, will be extremely limited. Co-occurring and similar disorders. It's not at all uncommon for individuals with avoidant personality disorder to have a co-occurring psychiatric disorder. This is true with the other personality disorders as well. Mood disorders, such as major depressive disorder or dysthymia, as well as anxiety disorders co-occur frequently with avoidant PD. Other personality disorders, such as dependent, borderline, schizoid, schizotypal, and paranoid, may also co-occur. Social phobia, also known as social anxiety disorder, and avoidant personality disorder have a substantial amount of overlap in terms of the overall clinical picture. This is especially true for generalized social phobia, in which the fear involves most social situations rather than specific ones. As a result, many experts look at these two disorders as essentially two sides of the same coin, in other words, a slightly different conceptualization of the same underlying disorder. That being said, Individuals with social phobia whose anxiety is limited to just one or very few social situations would not meet the criteria for a diagnosis of avoidant PD.